In this video, we're talking food sensitivity testing, one of my favorites. Food intolerance testing is so important, and I think it's so underutilized in the healthcare space. In this video, I'm going to explain why I think it's so important and who could benefit the most from being tested. Before we get into it quickly, I'm just going to give you my background. My name is Michelle Postal. I'm a board-certified nurse practitioner. I've been treating patients for about 14 years, and my goal is to get people healthy from a functional standpoint. Functional medicine providers use food testing as essentially the number one pillar. We have to get our foods right. There's so many people out there with food confusion. In the world of weight loss and weight loss resistance, I call it infobesity, where there's so much coming at you. You got keto, paleo, plant-based, low carb, sugar-free, dairy-free, gluten-free. You know, what do? You get food confusion. So getting food tested breaks through that confusion and provides clarity for you. It's very objective. We use third-party labs that do the analysis, and it's black and white. It's a yes or no. It's like, get rid of this food for 3 months, get rid of that food for 6 months. Okay, you get an acceptable food list based on how your immune system reacts to foods. So tying into that, 3 main reasons why you should test. Go grab a notebook and you're going to want to write this down, okay? Number 1 is that it takes pressure off of your gut. It takes stress off of your gut. People's guts are a mess. I know, because mine was one of them. So we know that most diseases and most dysfunction does start in the gut. If you have constipation, diarrhea, bloating, gas, heartburn, you eat something and you're like, oh my gosh, what was that? Like, should I not have dairy? Was it the eggs? Is it gluten? You want to know what it is. And again, you get confused. So people's guts are a mess. And this does take the stress off of your gut. That's reason number 1. Reason number 2 is that it takes stress off of your immune system. Okay. Ultimately, when we test, we're looking at your immune system, determine exactly how your immune system is responding and reacting. There are over 50 million Americans with an autoimmune condition. 50 million. That's about 1 in every 6 people. So lupus, MS, rheumatoid, celiac, Crohn's, Hashimoto's, there's about 140 of autoimmune labels, if you call it. And it's because our guts are a mess. We keep eating the wrong foods. Our immune system doesn't like it. Eventually, our immune system turns on itself and it starts attacking your own tissues. It happened to me. That's how I had celiac. You might attack your thyroid. That's called Hashimoto's. If it attacks your nervous system, well, there we have MS. So that is reason number 2. We have to take the stress off of the immune system, okay? Reason number 3 is that it does reduce inflammation. By eating the wrong foods, it drives inflammation. That's nothing new. When I was diagnosed with celiac, there's this book that came into my life, Your Hidden Food Allergies Are Making You Fat. There's over 300 pages of science and research that show how food sensitivities spike inflammation in your body. So we know that a lot of disease and dysfunction has an inflammatory cause where inflammation is the driving factor. When you look at heart disease, cancers, diabetes, strokes, even Alzheimer's, they all have an underlying inflammatory root cause. And we know that by eating the wrong foods, that drives that inflammation. So those are the 3 main reasons why I test. So who could benefit? People with weight loss resistance. If you've done it all, you feel stuck, you're stalled, you're plateaued. That's step 1, among other things, but that's your starting point. Okay, gut dysfunction, we already talked about. Brain fog, anxiety, depression, you're mentally cloudy. It's just that you're forgetful. Where are my keys? Where's my phone? Where is this? You're not as mentally sharp as you once were. We have to look at the gut then. There's something called the gut-brain axis. And essentially your gut is connected to your brain. So if your gut is a mess, often everything else is a mess. So ADHD, anxiety, depression, brain fog, we have to look at the gut. Even skin problems. So you might have eczema or psoriasis or acne or breakout in rashes. Usually there's a food component there. So you might even have chronic aches and pains, joint pain. You might have itises, I call it, whether it is bursitis or tendonitis or arthritis or gastritis. If you've been diagnosed with any form of itis, then you've had inflammation. So we have to address foods and we have to reduce the inflammation. Okay, this is autoimmune. Food testing is really step one. The test is very utilized, but it's so super important. So let's take an objective black and white look at the foods that you should not be eating. This testing allows me to start the foundation of healing at the cellular level on what is best for you. It's not one size fits all. This is very customized. It's based on your IgG immune response, and I can personalize what you're going to take, and that's going to give you the best results. So if you want to get tested, if you're checking any of those boxes off that I was saying, and you have all of these symptoms, I just want to kind of map out some of the most common ones. But if you want to get tested, your next step is to click the button and let's set up a one-on-one discovery call. This is just to make sure that what I have is right for you. It's not for everybody. It's not a pushy, high-pressure sales call, okay? This is simply a chance to ask each other questions and determine if food testing would make sense for you, okay? So go ahead and book that discovery call, and I will talk to you soon.